It was you that wiped all my tears. You're the one pulled me through.
Most diabetic patients start with a pill, and then another, followed by more pills. I wasn't so lucky. I was 31 when I was diagnosed of gestational diabetes. To avoid the negative effects on my baby, I started finger poking and an insulin shot before every meal. I don't know if gestational diabetes has much to do with my love for food and hate of exercises, or it is purely bad luck.
You know, gestational diabetes is actually caused by not enough insulin in the setting of insulin resistance. Risk factors include being overweight, previously having gestational diabetes, family history of type 2 diabetes, and having polycystic ovarian syndrome. It only happens roughly 3 to 9% of pregnancy, but the percentage is higher for Asians and some minority groups. 90% of the gestational diabetic patients recover, but your chance of developing diabetic gestational diabetes does increase greatly.
Well, let's say God feel I need to pay a price for getting a perfect baby. I accept. As I would give anything in the world to hold my beautiful little girl in my arm. And I can't do anything to risk her health. So, despite my craving for food made me want to cry every time I saw food I can't eat, I tried my best to follow the doctor's direction. But even with strict control, I can't stop the weight gain for myself and my baby. I had a C-section when the baby was estimated to be over 9 pounds 2 weeks before my due date. Gosh, I can't tell you how happy I was when I had my baby and took my victor meal when I was clear to eat. Thanks to God. Gestational diabetes went away when my beautiful baby left my womb. I was so happy.
No, actually, gestational diabetes can be prevented by maintaining a healthy weight and exercising before pregnancy. Most women are able to manage their blood sugar with a diet and exercise. If you have to take insulin shots, you must have a pretty bad blood sugar control.
Let's say I was never a model patient. Always so busy. And plus I have a baby and try to make more. And you know, my parents, both of them, they have type 2 diabetes.
Okay, is your baby healthy though?
Yeah, totally.
Oh, you're very lucky then. But you still must watch what you eat and exercise regularly, even after the baby's born.
But it is still so hard to exercise after the baby was born. You know, and I have full-time job. And besides that, I also have full time to watching my baby. Exercise. I thought exercise every day. Holding my daughter, taking her to daycare, work like a cow to feed her, and took double the workload so I can afford daycare. Going to gym and exercise is a luxury a new mom like me can't afford that. And guess what? After baby, my body looks like a blow-up meatloaf. I thought I can never have another baby because my husband would never even look at me. I tried to lose weight, but doctor, do you know how hard to juggle all these acts? I'm only human. I can't do anything. Plus, I'm no longer care for my looks. I give up on my husband, but I at least have my daughter to love.
You're not doing it for your husband. You're doing it for yourself, your health.
You are not a woman. You don't know the feeling of the selfishness. After the baby was born, I'm no longer myself. I'm the baby's mother. I can feel happiness only through her. I don't feel the joy of food when she was not holding her bottle, Food to me was just the gas needed to keep the machine going. I was not crazy about food, I was crazy about my baby. But no matter what I ate, I kept on gaining weight.
Your metabolism, the rate at which you burn calories, slows down much earlier than you might think. When you're just 25, it starts its inevitable decline, as much as 2 to 4% each year, but there are things you can do to lose weight, like eat a high-protein breakfast, avoid sugary drinks and fruit juices, drink water a half hour before meals, amongst other things. Choose weight loss friendly foods, eat soluble fiber, drink coffee or tea, eat mostly whole unprocessed foods, even eat your food slowly. You see, it's not that hard, right?
Actually, I know all that. I have to go to diabetes class when I was pregnant. But how you can work 2 jobs and still follow this diet when you have newborn, a house to clean, and a husband to feed?
But health is more important than anything. Think about your future. Think about your baby.
You don't think about those, at least till the reality hit you later. My OBGYN doctor said that it would not be a good idea for me to have another baby due to my age and health. But my baby needs a baby brother or sister, and I'm not going to deprive her that. After a year later, I was pregnant again, and this time, I knew all the drill.
Was the second pregnancy easier?
The pregnancy was fine. It was the shock and finger poking I hate. I tried my best to follow through, but I was older, heavier, and busier. Actually, very busy. Because now I have 2 babies to take care of. One in my tummy and one in my arm. I admit that didn't always follow the rules when I was hungry.
Oh no, your baby ate what you ate through your blood. You shouldn't do that.
Yes. That's why my doctor was worried. He put me on a machine so he can listen to the baby's heartbeat twice a week. He was afraid my baby may die. Like the last time, baby grew too big too fast. 4 weeks before due date, doc did all kind of tests, like anomalousness test, regular ultrasound. Eventually, my doctor decided to do another C-section for my safety to me and my baby. But he said the baby was not ready, so I have to wait.
I hate to say this, but your failure to control your blood sugar was very dangerous for your baby. Some babies have even died from blood sugar being out of control. Then the doctor had to run all those tests. He even had to schedule the C-section 3 weeks early. This was not good for both of you.
I know this was miserable, and I gained lots of weight. Even though I didn't eat too much, I threw up badly. And my tummy felt gigantic. And the surgery was before 3 weeks, my due date. And I started to contraction and before the scheduled surgery.
Yes, the swelling can be signs of preeclampsia. You may experience symptoms like severe shortness of breath, headaches, pain below your ribs, nausea, vomiting, heartburn. These are some symptoms you may experience. None of those are good for you and your baby. They're very dangerous, and you have to try to avoid having bad blood sugar in the future.
Yeah, yes. I feel blessed every day for living through that. I don't think I had preeclampsia, but I think gestational diabetes is just as bad. When I was rushed to the hospital, the waiting room was full. All of a sudden, all this expectation mother started contraction because of my condition. I got a bed in the recovery room. when many other moms were sitting in the chair screaming.
I can't believe that. You mean everyone started contractions at the same time?
Obviously, the stuff was not ready. They were short stuffed when the contraction was getting worse. But I was so swollen. The nurse couldn't wait to injection IV. They finally got it after trying to take 20 times. Then I had the cutest baby boy in the world.
So both you and the baby are okay after the delivery?
The baby was great, but I became a carryover.
Oh, so you have diabetes after the baby was born. Oh, that's interesting. 90% of gestational patients recover from that.
If I losing my health, that price to pay I have to have my son, then I got there.
Well, it doesn't have to be like that. Many people have a baby and they're fully healthy after having a baby. And even with diabetes, though, you can live a very healthy, productive life. So life is good.
Yeah, the doctor tried everything to help me, and I started taking glipizide.
Glipizide belongs to the class of drugs known as sulfonylureas. It lowers blood sugar by causing the release of your body's natural insulin. It's quite effective if you use it with proper diet and exercise.
It worked well for a while, but my blood sugar starting spiking again. It's just like my body fighting with the war with this kind of medicine. They just find way to defeat the medicine.
That's not true.
Yes. But almost. But you know, not really.
Did you exercise and watch your diet?
I admit, I was a very bad patient. I just feel like a prisoner. I can't eat what I want to eat, and I can't do what I want to do. So imagine if you have 2 babies in your life and have 3 jobs in the meanwhile, how could you possibly have time to make healthy food and exercise?
But you have to remember you're not doing it for yourself. You have 2 babies. You have to remain healthy for those babies.
Yeah, yes, I know. I was a bad mother. Then I got Google page, those big posts work fine, and I did lose some weight.
This works differently. This works to lower the amount of sugar in your blood of people with diabetes. It does this by lowering the amount of sugar produced in the liver and also increasing the sensitivity of muscle cells to insulin. Metformin lowers blood sugar levels between and after meals.
It worked fine for a while. And then my blood sugar will be bad again. So doctor raised the dosage again and again. While this medicine lose the race against my blood sugar, doctor put me on Actos.
Actos, which is also known as pioglitazone, is a once-daily oral medication for people with type 2 diabetes, part of the anti-diabetic drug class known as thiazolidinediones. It works by increasing your body's sensitivity to its own insulin, allowing the hormone to work more effectively in improving blood glucose control. Unfortunately, Actos has been linked to a significantly increased risk of bladder cancer in various studies. Doctors no longer prescribe it.
Too bad it's bad, because it worked well on my blood sugar. By now, a few years has already passed. I'm a woman in my late 30s with way below average health. I quit my job because I can't deal with it anymore. But I have to take on additional work to compensate the lost income. Doctor was concerned about my health, so they put the close watch on my heart.
Over time, high blood sugar leads to a buildup of plaque in the arteries. This buildup can harden and narrow your blood vessels, reducing the flow of oxygenated blood to the heart. As a result, you're more likely to have heart problems in the future.
I remember brought my kid with me when we went for the treadmill test. I asked the nurse, "Can my family come in with me?" And nurse said, "Are these your grandkids?" I admit I looked terrible for my age, but I never thought I looked that old. I angrily protested to the nurse and she said, "Sorry, My patients do this test are in their 70s. On my way back, my daughter asked me, Mom, when we sell lemonade after you die, how much should we charge? $1 or 50 cents? I realized how horrible it is to expose my children to my failing health.
If you do the right things, it's not too late.
I wish I had listened to you, because I no longer have a job, and healthcare costs an arm and a leg. So I choose not to buy dental insurance, and I have not visited any dentist for 5 years till the pain left me no choice. With poor control on my blood sugar, it shouldn't be a surprise that my sugar-located blood can fight the bacteria eating away my bones and destroy my gum. But I cried like a baby when doctor had pulled my perfect health tooth away because gum infection and bone loss. Let me correct myself. I did not cry like a baby. I tried to put a brave face on, but I just can't stop tears flowing down. It was not a pain that made me cry, but the warning I record. Diabetic patient may die a painful death. One piece at a time, you can lose your toes, then your leg. It can break your heart, literally. And I know the process started on me when I lost my first tooth.
Don't be sad. With technological advances, you can get teeth implants.
No, I can't. I went for consultation. I paid for 360 expensive filming on my mouth. I was told the bone loss was so great. I can't get tooth implant. A few years later, I lost another tooth on the other side, and I can't even eat my favorite barbecue.
Barbecue's not good for you.
I know. Plus I can't chew. But cake and milkshake didn't help with my blood sugar. I soon was prescribed insulin, and my blood sugar would be under control for a few months, then spike again. Okay, for a few more months after doctor prescribed increased the dosage, and spike again. The doctor didn't know, but they were fighting on losing course, because I gave myself up on already.
You must not give up. We can't help you if you don't want to help yourself.
There are times I wanted to do the right thing, but getting up earlier is hard. When you hard to work till midnight. Exercise is great, but not when your heart rates faster than you can after 5 minutes work.
You must force yourself. You're fighting the battle. You're the only one who can win. We can only help. We can't do the fight for you.
And my husband left me for someone half my age and half my size. I felt betrayed. I felt deserted. I felt unwanted. I felt alone and defeated.
I'm very sorry.
So I decided to find someone who would love me. I know no one would. So I exercised and pretty much starved myself. I went for a tummy tuck, and in a few months, I looked great again.
You see, you can do it.
But that was not healthy. I didn't find any Prince Charming. I was heartbroken again and again. I was a very emotional person, I guess. The depression quickly and unhealthy choice to lose weight didn't help my mental and physical state. I then fight into possible cancer and I went through 2 surgeries. The blood sugar went banana also.
The rapid weight gain and loss can cause issues with your heart. Your heart is like an engine running in a machine. You kept on playing with the machine's capacity. One day it can ruin the engine.
Indeed. I was sent to ER once the doctor had to restart my heart when everything else failed. I was given a new chance in life, but I felt like living on borrowed time. I don't know when I will go. I don't know what to do.
You should take better care of yourself. You should not give up.
I took so many medicines. My liver started to act weird. Doctor had to stop my medicines and start me on high dosage of insulin. So I poke my fingers 4 times a day, get 5 insulin shots, and still had poor blood control.
It takes time. Doctors can't wave the magic wand at you and cure you instantly. You need to exercise regularly, control your weight, watch what you eat, and most importantly, have a positive attitude about life.
That's easier to say than done. If I can do that, I will never put myself in this place.
But it's never too late to change.
So doctor started me on this new medicine. It worked different than other medicine. It let go the sugar in my blood through urination. So far, it is working out great.
Then please work with your doctors closely. You're still young. You can still live a good life.
I know. Thank you.
Would you stay with me? Don't make me walk alone. It was you that wiped all my tears. You're the one pulled me through. Please don't give up the fight. I just can't let you go. Let love carry